Have you been searching for pain solutions that don't involve incisions, addictions, injections, medications, or complications? If yes, this podcast is for you. Pain Relief University's hope for everyone is that you stop suffering needlessly and experience relief naturally. May this podcast provide you the combination of remedies that make pain-free living your new reality. Let's get started. Good evening, everyone. This is Arthur Toole with Pain Relief University, where our goal is to come in and help you know what the experts are saying about pain and things that you can do to just work through that pain before you go under the knife, before you take another pill. So with me, I have just an expert and a friend and an accountability partner, Eulanda Waller, who's been an occupational therapist for, well, actually, I'm not going to steal her show. First, thank you for coming on to our humble, small podcast. But will you please, for our audience, tell them, who you are, what you do, how long you've been at occupational therapist, and anything else you want to share to start us off.
Well, thank you so much, Arthur, for this opportunity. It is a privilege and an honor to be on here to speak with you and your audience. My name is Eulanda Waller. I am an occupational therapist in the Macon, Middle Georgia area. I have been practicing for 19 plus years, and my specialty is pretty much geriatrics, seniors, those who want to age in place, who do not want to be forced to go to a long-term care facility or memory care facility. So I work with seniors in the community by educating them on fall prevention strategies, also on things that they can do to make their home environment safe. I also have experience with skilled nursing facilities, been in long-term care for about 10 years. I've been doing home health for as long as that as well, and acute rehab. So I have had my hands in patients along the whole gamut.
Yeah. You do everything. So,
I do, yeah, I've done a little bit of everything, but my passion is pretty much for those seniors who want to stay active, who want to thrive, who want to be able to be independent and live at home safely and not necessarily have to live with their children or in a nursing home. So my goal is to equip them and empower them to be able to do that.
Gotcha. So first I want to say thank you for what you do, because my mom was, she was an occupational therapist. What is it? Do they call them CODAs? Is that what they call them?
Yeah, occupational therapy assistants.
Yes, so she was occupational therapist assistant. And that was when I first got exposure to you all's universe and what you all do. And then it was later in the military, after I had an accident, had surgery, that I became to know about occupational therapists and physical therapists and just the whole rehabilitation to get back to normal life. So with you guys now, I'm fully functional because I tore some ligaments in a couple of different places because of the military. So I am grateful. And then for my mom, she had both knees replaced. And it was an occupational therapist that came in first, and then it was a physical therapist that came in later that helped her. So you guys are critical. But I will start with this. Why is it that a lot of people don't know about what you guys do? All right, because like for me, if it wasn't for my mom, I wouldn't have known until I was forced to. So it's like, I know a doctor, I know a dentist, I know a chiropractor. Why aren't more people aware of occupational therapy?
Most time, I believe, because not a lot of occupational therapists are in private practice. So you will be introduced to an occupational therapist once you go into a hospital or after you've had surgery, and then that surgeon refer you to an outpatient clinic where specifically if it's for a shoulder or a hand, they can order occupational therapy for that. Or if you have to go to rehab after you've been hospitalized after a traumatic injury or some type of health event where you're not able to go home and you need a little bit more time to recuperate. So that's most time when people are introduced to occupational therapists. However, occupational therapists work with people across the lifespan. So even infants, newborns, an occupational therapist will work with them if, for instance, there were a situation during birth and, there are some babies that are born and they have their arm is like caught in the birth canal and they have the ligaments that stretch, so they can work with them. After giving birth, the nurse is going to check for certain reflexes that should be there. If those reflexes aren't there because of either the birthing event or some type of developmental issue, they can call an occupational therapist in. And so through the lifespan, because occupational therapists help people to regain function or be independent as possible despite their injuries or their disabilities, whether it's mental or physical. They can work with kids to make sure they meet their developmental milestones, to be able to, go to school and learn and to be independent. But also, in adulthood, most time when there's injuries, that's when people are introduced to occupational therapists.
You know what? I forgot to mention how we were introduced. I came to know you through our mutual friend Katherine, who I mentioned before we started the podcast. She was a physical therapist, but our youngest son had some motor development challenges. And when I went to Katherine, you were the one that she recommended, and you were the one that gave us like the initial tools to use to help our youngest son develop, and it worked out. But I would have never ever thought, oh, let's reach out to occupational therapists, right? So I think like people really need to know what you guys do, because if they know, then they can be less dependent on drugs, or they can be less dependent on the immediately jump into surgery and things like that. Are there anything going on to build more awareness around occupational therapists?
Yeah, absolutely.
Field?
Where there is amongst my colleagues. So we're building a community where we're empowering each other to be more independent and to be in private practice and to be able to provide services to improve the accessibility for people to find occupational therapists. Unfortunately, people or sometimes it's doctors who lump us together as physical therapy. And we work closely together, but our outcomes and our strategies are somewhat different. So it has to be specifically separate. So if there's someone, say for instance, a parent who child is having some behavioral issues. I remember being in a restaurant not too long ago, and a family came in, and the daughter, you could tell, she was hyperactive. She was excited about being there. It was crowded. So you can tell, I could tell, because I know of how certain sensory input may affect the child. Right. So the father was behind me, and he said to his wife, he's like, let's just go, because the child was, running to the table. She was under the table, she just couldn't sit still. And so I encouraged him to stay, and I encouraged him, that she's fine, it's okay, that we can, society is going to learn to accept certain behaviors. And so they did stay, and I observed those type of behaviors, but evidently the family may not know how to communicate that to the pediatrician, that she just can't sit still when she's in an environment, she's all over the place. She can't organize herself and calm down and be able to enjoy a meal in peace. So that lets me know there are some sensory motor issues. And there's the spectrum of autism, there's the spectrum of sensory processing disorder, and testing is done to determine what that is. And because, most people think of a psychiatrist as doing the testing, but occupational therapists also do testing, because we look at the whole person. So we're going to look at their.
What kind of testing do you do? I just want to make some people know.
Yeah. So there are comprehensive assessments that we do. So it's going to look at their visual perception. It's going to look at their motor coordination. It's going to look at their strength. It's going to look at their cognition. And so we take that data and we put it all together, and then we get a score. And based on that score and our interpretation of what we see and how the child responds, we can make recommendations for them. And then the treatment goes along with that.
Okay, so let me give some scenarios for our audience. So going back to you were having breakfast at a restaurant, the child was running around. Normally, most of us would just call that a bad child, or a child that's really, really energetic. But for you, because of your background, you recognize that it may not be that. So if I have a child that just can't sit still for whatever reason,
if I go to the doctor, they're just going to say they're hyperactive, right? And they're going
Give
to
it, yeah,
give them,
Ritalin or something like that. Yeah.
but I can take them to you, and there may be some things that you can do to help us work through that.
Right. And so the thing about that would be a medical service. So their pediatrician or your doctor has to give us an order to provide treatment. So before you do medication, you can ask, and people have to communicate and talk with their doctor. And sometimes they have to bring it up. So can I get a referral for an occupational therapist? Do you know of an occupational therapist in the area that can assess my child or assess me if it's something related to pain or function, anything like that? And 9 times out of 10, they will have a list of providers. If not, they can definitely find one. A referral nurses most time is in the office and they can find one. But if you do your own research and your homework, you can choose who you want as a therapist, occupational therapist, physical therapist, just like you choose your doctor or your dentist. You can choose.
Is that still based on the type of insurance that you have, or can I be in Maryland and pick an occupational therapist in Georgia?
So it depends. If you want your insurance to pay for it, you would find a provider who is within your insurance network.
So in network, okay.
Yeah, and then so because we are licensed by state, so it will be
okay.
Yeah.
So let me, there's some other scenarios of where occupational therapy could help a person. So we had the young kids, and then we had our kid who had some developmental challenges and some motor skill challenges. Like he literally could not squeeze his hand and he couldn't write well. And we just thought he didn't know how to write well. It turned out his hands were physically weak. And so we did squeezing exercises that you taught us, and that helped him out tremendously. But I know you did, before we get to the elderly, what are some scenarios that I guess like the 20, 30, 40-year-old could find themselves in that before they go to surgery, they should come see you?
Right. So it could be anything from an athlete who may have an injury and it doesn't go away in 2 or 3 days. So they can seek an occupational therapist for an evaluation to determine, one, the source of the pain and treat that source of pain and improve their range of motion, flexibility, strength. Also, those who may work and may, with repetitive motion, they may experience some type of pain or discomfort. It affects their ability to perform their job. So again, occupational therapists do on-site ergonomic assessments and make recommendations of not only, I know a lot of companies have learned how to like set up desks and computers at eye level and keyboard, but also we assess how the person performs the job, and we can make recommendations of how to do the job maybe more efficiently, where it's not going to be overworking, say, your shoulders, or if you have to stand for a long period of time, educating the corporation on how to encourage more rest breaks or changing the flow of the work. And maybe it may be how the if it's a conveyor line, how that's set up. It's just different things that we can look at and make recommendations for that age group. It can be anyone who lifting furniture, and you hurt your back, and then it may last for a while. It may be just a simple injury, or it can be a traumatic injury. And then after that, we've had people who have had to have surgery and they want to return to work. So after surgery, you think you're just going to wake up from surgery and be able to get up and continue to do your daily routines, but that may not be the case. So we have to retrain you to do your dressing, do your toileting, adhering to those final precautions after surgery. And then work your way up to where you can perform your job, at the best quality that you can. It can be anything from an accident, if someone gets in an accident and get injury. So it can be anything, actually. So
Got it. So what's the difference? And just pardon my ignorance. So probably about 7 years ago, my wife did that guy. She was rear-ended, and the guy just hit and ran, and
Mm,
he ended up not being able to. I mean, she was in constant pain.
mm,
In actuality, is one of the reasons we have Meg relief, but at that time we didn't. And somebody recommended a chiropractor to her, and I was adamantly, against, chiropractors, not because of anything. I had no experience, but it was my ignorance that made me against, chiropractors. But nothing else worked. Pain meds didn't work. The doctors were like, "Oh, just give it time." But now we're talking months in, and she still have like serious pain, like 10 out of 10. So she went to a chiropractor, they did something, and then she found some relief. And then, now she had to go every week, like 2, 3 times a week, until finally we was like, enough, we're not gonna go anymore.
right.
If one, it's a two-part question. So what would have been different if she would have came to an occupational therapist after a car accident? Or would that have been a good approach? And two, then a later question is, what's the difference between a chiropractor and an occupational therapist? And you can take either one. And the reason I ask this is because based on what you're saying, th- some of those things they told us, and that's what led us to go to a chiropractor for her.
Yeah. Yeah. So they probably recommended a chiropractor. Well, this is what really can help is we get a clear diagnosis of what's going on. So they're going to do, if either at the hospital or through or orthopedist or neurosurgeon, depending on where the pain is, to do a diagnostic test. So whether, okay, your x-ray is going to show you bones. Okay. So if there's a fracture or misalignment, it can show you, but you're going to need most likely a CAT scan or MRI to show any type of soft tissue or other layers of the anatomy to show us if there's a tear, if there's some type of some labor, some things in the disc that are herniated. Like we need to know, we need a clear diagnosis from the doctor. Okay. So with a chiropractor, the chiropractor is going to focus on the spine. Okay. The spine and joints. And so what their goal is to be able to improve the alignment. So you would have improved mobility and relieve the pain. But if it's more of a soft tissue issue, then the approach to for healing would be different. Okay. So if your pain is limiting you from doing your daily activity, or if it's leading to depression, or you're not, you're more fatigued, then as far as an occupational therapist, we're going to address all of those areas. So with the pain, depending on, I would do a more thorough interview. What type of pain? Can you describe it? When does it happen? What are you doing now? How effective is that? What have you tried this? And give you some alternatives of what you can do for pain management. And then incorporating that when your pain is at its least or without, trying to engage you in some type of exercises to improve your mobility, engaging you in your functional whatever activity you need to do when your pain is less. So we're going to do a regimen. We're going to look at that to improve your overall ability to be able to function again. Now, another option for any type of vertebral or spinal issues is the physical therapist, because they're also trained as well to be able to do some type of distractions and mobility. Some occupational therapists have that skill set too. We're just not as aggressive at doing like the popping and all of that kind of stuff. So, and we also use modalities as well. So whether it's that thermal, so either heat or cold pack, using ultrasound, those type of things that reduce the inflammation in the area, and be able to then work towards the range of motion or the soft tissue massages and trying to, break up the adhesions and things like that. It's not as aggressive as chiropractors, but it's still a lot of times effective if it can be. corrected without.
Gotcha. All right, so I'm gonna switch it up for us a little bit. So answer this: why occupational therapy? Like, you could have done, from the sounds of it, you could have done a bunch of things. Yet you chose occupational therapy. What was it?
Right. So yeah, that was the plan. When you leave high school and you go to college, the plan is to go pre-med, right? So actually, it was like my junior year, I believe it was, and I was a part of the healthcare society at my university. And we went on this college tour of med schools, and lo and behold, at the Howard University Med School, the allied health students came in, and they did a presentation on physical therapy and occupational therapy and maybe speech therapy. But listening to the presentation and talking about what occupational therapy does, I was like, that would fit my lifestyle. Like, I would be able to help people, more. I'm not just going to meet them in an office and see them, once or twice a year. And, I would be able to build a relationship, really help them to regain their life, which would be an overall benefit, for them in the long run. And, you'll be able to serve more people. Like, I figured, I might get bored doing the same thing for 30, 40 years.
Oh yeah.
So yeah. And so I can change it up. I can work with kids. I can work with adults. I can work with seniors. I can work in the work industry. I can work, different areas. So the variety of the profession, it hit home with me. It didn't seem like something that would be so stressful and time consuming. Like, I want work-life balance, right? So being an entrepreneur, that changes that, but that was the goal back then, to be able to work, and not being so like looking in a microscope, because I was a biology major too. So looking in a microscope all day, or writing prescriptions. Like, I didn't want that lifestyle. I wanted to be able to relate to people and be able to help them in the long run. So
Gotcha.
that's why I chose it. Yeah.
So then tell me about your most satisfying experience working with a patient. Like,
Right.
that set it up. Like, what did they experience? What did you do? How did it end? Like lead us through that.
Jeez, man, it's so many. Like, I think one would be a patient that I had in the home health setting. It was a lady, and she was bedbound when I met her. She wasn't able to get up and go to the bathroom anymore. She lived with her daughter, but her daughter worked. So she was at home by herself. She would have to wait till her daughter gets home from work to be able to, either get her, if she was having an incontinent episode, to get cleaned up, or to get things that she may wanted for herself, like a snack or something. Her daughter may come during the day or whatever. And so this lady, she was morbidly obese. She had knee replacement, and it was a failed knee replacement. So her knee would give out. So she had a fear of falling. She was oxygen dependent. She had congestive heart failure. It was just a number of, she was a breast cancer survivor. It's just a lot of medical issues that she had. And so I went in, and so when you have patients like this, of course they're anxious. They don't trust you. They don't trust themselves. They don't trust you. So to be able to get this lady to at least the side of the bed took a lot of encouragement, getting her to trust me. But within a week or two, we was able to get her to the side of the bed. Shortly after that, we was able to walk to the bathroom where she could use the toilet. We started working on shower transfer. So she was able to get in the shower, have the aide give her a shower, shampoo her hair, like those type of things that we take for granted. Like, to be able to do that, like, it would change her whole life. And so about in a month, during the course of our time working together, we was working on walking longer distances. So they lived in an apartment. So the goal was to be able to walk to the kitchen. So if you wanted to get you a beverage, get you a snack, you'll be able to do that safely. So we were able to get her, she has a rollator walker, so it has the seat. And I remind you, she is oxygen dependent. She has congestive heart failure, so her stamina is really low. So, but we were able to accomplish that. She was able to walk to the kitchen. We would do kitchen tasks, so having her reaching the cabinets, reaching the refrigerator. Lo and behold, this was leading up to Thanksgiving. And this lady got so much better. Like, she cooked Thanksgiving dinner with her family. Like, what? I just expected you to fix a sandwich or reheat something in the microwave, and you're doing Thanksgiving dinner. And she threw down. Yeah, that's a good one. So those type of outcomes really makes me proud. There was another lady. She had a respiratory disease. It was cystic fibrosis. Yeah. And she was on hospice, actually. And so, but her family didn't want to give up.
Hold on. For those who don't know what hospice is, break that down for them.
Right. So hospice is the medical service for people who have a chronic disease or a terminal disease where their life expectancy is not expected to improve, or they are expected to expire within 6 months or 12 months. Okay. So she had came from the hospital, and she was referred to hospice for in-home care. So you get nursing to come in, you have a doctor who can do a home visit, respiratory therapy, you can get supplies. So it helps the family to be able to take care of them at home, and not, have to go to a nursing home or stay in a hospital long term. So, or a nursing home. So anyway, working with her, again with Katherine, we work with her. And so just to be able to roll in bed and to sit up was a chore. And so we would do exercises, and just imagine, like, now with the pandemic, people understand how, when your lungs are constricted, how hard it is to breathe. So just being able to sit up or being able to change position, like, it is exhausting. But she was able to, conquer that, improve her ability to stand and her range of motion, her strength. And so as she improved, I would just introduce her to different things. So one of her favorite things to do was cook for her family. So there were certain dishes that they, enjoyed for her to do. And also for herself, she was independent before she went to the hospital. So she was able to live on her own, and she did whatever she needs to do for herself. So for her to have her children take care of her, she felt guilty about doing that. She wanted to be able to do more for herself. So we would do things in the kitchen. We would be able to, do things. The other thing, she was afraid of falling. So I was able to recommend the necessary bathroom equipment so she could be able to, go to the toilet, take a shower. Those things are very important to me. Yeah, I think it makes anyone who's sick feel better. And also to be able to do those things and dress herself. But the biggest thing was, so one of the nurses came and did a assessment of her. And she was sitting up in the chair, and she was working on this sewing activity. It was like a Christmas stocking that she makes for her children, grandchildren. This has been tradition in her family. And then she said the nurse was surprised that she wasn't in bed, that she was sitting up. And she's like, yeah, she said, I don't lay in the bed. She said, I get up every day. I do whatever she wants to do for the day. So cool. But the good thing about that, this lady got so much better. Her family celebrated her birthday. So she had her children and her grandchildren and her great-grandchildren. They celebrate, I forget which number, it was like 80 something. They celebrated her birthday with her.
Wow. You gave her life back.
Gave her life. I mean, she wasn't in the bed. She was sitting at the table dressed, enjoying the meal and talking with her family.
Yeah. No, that's awesome. That's awesome.
Those are good.
No, those are really good. So if my child has motor development skills, I can come see you. If I have an elderly parent who's falling or who can't bathe themselves, who can't get out the bed, or they're in a lot of pain, I can bring them to you. If I'm experiencing, severe pain that's impeding my daily life, like it's impeding my ability to work, my ability to walk, I can come see you. That's your area.
That's our area.
Okay.
So, and also with that, of course, there are situations where a lot of our seniors have arthritis, right? That is the most common syndrome that everyone has. It can get so severe that it affects their ability to move. And again, when people have to deal with pain every day, like it starts to affect their mentality, their emotions, right?
Yeah.
They try to protect themselves and not have to, cause anything that's going to cause more pain or that's going to be uncomfortable for them. So it's very important that we go in and educate our patients on how to manage their pain, for one, the proper exercises they need. Because if it's arthritis, most time we're going to work on strengthening the muscles that support that joint, okay, to eliminate falls, to elongate the muscles and the tendons and the muscles, so they will be able to do what they need to do. But the main thing is being able to manage the pain. And so again, like there are things, even though in the clinic or in the hospital, we use more sophisticated modalities, our heating packs or our cold pack, ice packs, our ultrasounds. But you still can do that at home. I mean, even if they don't have a full ice pack, you get your bag of frozen peas, or if you got some Ziploc bags, we can put some ice cubes in that and just use that. You know what I'm saying? It doesn't have to be that, but we got to be able to do what we need to do to get where we're trying to get, right?
Nice.
And so the other thing is, I think it's hard for people, or they get tired of telling, their healthcare professional that they hurt. But it's very important to advocate for what you need, be able to describe the pain. And I tell people to write it down. So when you go to your doctor's office, it may not come to mind, but if you can explain to them, okay, it's a burning pain, or it's an aching pain, it's a stabbing pain, and tell them where it is or when do you feel it, most time it'll help them kind of get the right services or referrals to a specialist, or the right type of, if it's medication. A lot of people don't want to take medication. So and because of the opioid abuse, most times they're just going to get Tylenol anyway, Tylenol.
That's what I was going to ask you about that. So how many of your patients do you prescribe medication as an occupational therapist? Okay.
No, not at all.
Do many of your patients that come in to see you, like your elderly patients, are they already typically on prescription medication for pain?
Right. Most time they are. And again, most recently in the last year or two, probably 2 or 3 maybe, it's not going to be your narcotics or your opioids anymore.
Okay. So you are saying they're trying to get away from the opioids?
Yeah.
Okay.
From chronic use. Now, if it's something like if you just had a hip replacement, they're going to recommend a narcotic for that. But most seniors, they're so afraid of getting addicted to it, they don't really want to take it anyway. So not a lot, but there are some, they go to the pain clinic and they can get those pills. And does it help? It's a short-term relief, but the side effects of long-term use of opioids, I mean, I wouldn't recommend it. I would recommend them do some alternative things, to help with their pain management.
Yeah, no. Have you seen someone that suffered severe side effects from opioid use? Or prescription drug use?
Most time it's going to be constipation.
Okay.
Yeah, it's going to be something like that. It's going to be liver issues, or kidney function, long-term use of ibuprofen, stuff like that, or depending on what their other health conditions are, they shouldn't even take those type of medications. But then there are those who are addicted to it. But the other thing about that, sometimes patients who have depression, they're going to perceive pain. And so it's kind of hard to say, are you feeling pain or are you perceiving pain? So that's the other thing about therapists. We're going to try to get to the root of what's really limiting your abilities there.
So I know for me, when I had the major surgery I had on my wrist, they gave me, I don't know what the prescription was, but again, like I said in the beginning, my mom was a coder. She took the meds, and she was like, "You're not going to have these."
Yeah.
I was looking at, like, the doctor told me to try. She said, I don't care. You're not having this. You can have a couple of Tylenol, and then that's it. And so I know I know about addictions because I've seen that in our family, but I've never taken prescription drugs. And then for her, when she had both her knees replaced, she opted for ibuprofen. I think she did maybe like the prescription drug a couple of times, and she switched to ibuprofen. And then from there, and she was doing that like 4 or 5 times a day. And then, at that time, that's when Megrelif came online, and she went from 4 or 5 times a day for ibuprofen to once every other day on Megrelif. But she had knowledge like you, and so, like, listen, like, we don't want the side effects of prescription drugs. And so that's just tough. That's just tough. But it's good that you're saying that in the industry, people are steering away from opioids now.
Right.
So that's a good thing. I didn't know that people were. I was just thinking if you had surgery, it was just automatic. They're going to give you opioids. Right.
Well, the thing is that some patients are mad because they can't get that. But it's not it's not just that the doctor don't want to write the prescription. I mean, it's coming from legislature. Like, yeah, they are trying to it's like a war on prescription drugs, on opioids. So it's not like they can just all willy-nilly just give you that. They're gonna do that maybe for the first 30 days, but to get a refill, it's hard to get a refill.
I say no refills on Percocet or
no. Yeah. And I'm like, you take Percocet, like, and you still sitting up.
they eat it like Tic Tac. Yeah.
Right.
Oh no, that's good stuff. So I've taken a lot of your time, and I want to respect your time, but I want to talk about the last thing about your business, right? Like, you have a couple. So if you could just go into, like, what are you doing? I know you target the elderly, but what are some of the services that you provide? And then just give us your web address and telephone number if people are in the Macon area and want to use your services, or if you only serve people in the Macon area. If you can assist outside of that, then share that as well.
Right. So as far as the occupational therapy services, it is for private practice where I do a mobile outpatient service. So I'm able to go to the patient's home and provide those services in home. And so what my niche is for fall prevention. So I do balance training, also anything with aging in place. So I do home safety assessments and make recommendations for those who may need modifications in their home, especially for those who have either mobility issues or those who've had a stroke, those who've had amputations, those type of things where they want to be able to live in their home and be able to, safely still, move around their home, or the caregiver needs to be able to provide care for those people. So I make those recommendations that's needed. Also, I can do wellness programs. So even though it may not be a skilled therapy session, but for those who want to maintain their strength and their stamina, it's not going to be like a personal trainer. I'm not going to have you trying to run sprints and trying to do do full push-ups and those type of things, but it's going to be a individual exercise program to be able to maintain their strength, their mobility, their flexibility, to be healthy and to live as pain-free or less restrictive as possible. And also for those people who are in the community, but they need a little bit more support, medical management or medical monitoring, that's where my adult day health center comes in. So for those individuals who have aging parents, but they still want to work, or if they just need a break, it can be even a spouse, this is a safe place for them to send their loved one, where they can be looked at during the day. We have a nurse on staff. Therapy services are provided there as well. They have fun, they do activities, games, and socialize with other people. So the whole thing is to be able to have thriving seniors in the community, right? Even though you may not drive, you may not have the same friends, but you can still be active and engaged and have a purpose every day. And that's called Daily Grace Adult Day Health Services. And the website for Daily Grace is dailygraceadh.com. And for my occupational therapy services, Waller, WALLEROT.com. And so both websites can get you in contact with me if you have specific questions. So
Awesome. Well, thank you so much. This has been awesome. Again, I personally thank you because of all the things you've done for my family. And it's just been a blessing. So thank you.
Right.
And everybody, listen, if you have parents that, are falling, they're getting up there in age, or they can't do the basic things that, that they used to be able to do, I mean, definitely contact an occupational therapist. Your insurance will cover it most likely, right?
Right. Yeah. So yeah, Medicare covers it, the Medicare Advantage plans. But they can just call me and we can go over that, what their benefits will cover. And then
leave them with your number too.
So the number to reach me at is 478-227-8968. Awesome. 478-227-8968. Awesome.
So you have any final words for our audience?
Yes. So for if you're having any type of pain, please communicate with your doctor about the pain, and seek the expertise of a physical therapist or an occupational therapist. Try those before you do your injections and your surgeries, and have to take pain medication for an extended period of time. I'm sure you will find someone in the area who can help meet your needs. And also movement is powerful. So even like your yogas or your Pilates, gentle exercise programs, those are beneficial because God designed our bodies to be able to heal itself. So try those alternative methods, and it doesn't hurt to try Meg Relief and use that consistently.
Of course. Thank you for the that kind plug. I appreciate it.
Yeah.
All right, you guys, we will see you all next time. We're out of here.
Thank you.
Thank you.
Be healthy.
That wraps up another episode of Pain Relief University. I hope that you were able to find something in this episode that you can use and apply to your life to get you one step closer to that pain-free lifestyle. Please like and subscribe to our podcast. Also, leave a testimony. That helps us be seen by more people. And lastly, if there's somebody out there that you know that is struggling with joint pain, share this with them. No one should have to be stuck with joint pain. And hopefully now they know they have options. All right, now, see you next time. Be blessed.